I'm Dr. Ahmed Kazmi, and I am a UK-trained consultant dermatologist and GP, currently based in Australia. I am a general dermatologist, so I deal with all pediatric and adult dermatoses, but my primary focus are hair and scalp disorders and medical education. But I also have a special interest in psychodermatology, skin of color dermatology, small molecules, and transgender medicine. It's impossible not to have an effective consultation and good consultation skills without always tailoring how you communicate based on the patient in front of you. So factors such as their first language, their educational level, intellectual capacity, all of these things have quite profound effects on how you might choose to articulate or engage with the patient, and it really does have to be adapted in every context to get the best out of that consultation for that patient. In the context, for example, of someone who doesn't speak English, I'll always try to use an interpreter, and ideally I prefer for this to be a professional interpreter rather than a relative, because I find relatives sometimes it's too close to home and they struggle to be fully impartial. But if I can't get an interpreter, then a family member is fine. And in this context, I'll also try very hard to make my sentences really short and really concise. And this will mean, therefore, that the person doing the interpreting is much more able to accurately interpret the information. I'll often, in the case of intellectual impairment, also adjust my vocabulary or my turn of phrase to ensure that it's within the realm of understanding of the patient and the carer. And often, because in this context carers are often changing, I will definitely make sure that the instructions are clearly in written form so that all carers are able to replicate the treatment plan. In the context of older patients and patients from ethnic minority groups, I also find that they tend to favor a more traditional or paternalistic consultation approach compared to younger patients, for example, who may be more patient-centered or consumerist in their approach. So for older patients and for ethnic minority groups, I approach patient-centeredness in a different way, where rather than giving them a list of options alone, or asking them, for example, what they would like to do. This is often met with confusion or distrust in the clinician for asking how they would like to proceed. I might explain what the options are and ask if they have a preferred option out of those.